Stop. Before you take the NCLEX, you need to hear this. Did you know that in 2024, almost 10% of U.S. educated students failed the NCLEX? Nearly half of repeat test takers failed again? And nearly 50% of international students failed on their first try? Only 36% of repeat test takers actually passed. These are real stats from ncsbn.org. But here's the big question. Is NCLEX really that difficult? Or are students just not using the right strategies? In this video, we're not just talking about why students fail. We're breaking down real NCLEX strategies and practice questions with detailed explanations, so you know exactly how to pass on your first try. No fluff, no motivation talk, just the strategies that actually work. Let's get started. 1. Not understanding the NCLEX format. You might think the NCLEX is just another nursing exam, but it's not. The test is adaptive. That means if you keep getting questions wrong, the test actually gets harder. And if you don't know how to handle that, it can work against you. That's why you need to understand different question styles. Select all that apply, prioritization, case studies, because knowing the content isn't enough. Now let's test this out with a question. A patient with congestive heart failure is prescribed furosemide. Which of the following statements is true regarding assessments before administration? Option 1, blood pressure should be checked to prevent hypotension. Option 2, serum potassium levels should be monitored due to the risk of hypokalemia. Option 3, respiratory rate is the most important assessment before giving furosemide. Option 4, urine output is not relevant when administering furosemide. Option 5, furosemide should only be given if the patient's heart rate is above 60 BPM. Option 6, liver function tests should be prioritized before furosemide administration. Take a moment to think about it. Got your answers? Let's break it down. Correct answers, Option 1 and Option 2. Explanation. Option 1 is correct. Furosemide can cause significant drops in blood pressure, so checking BP before giving the medication is critical. Option 2 is correct. Furosemide is a loop diuretic. It pulls fluid out, but it also flushes out potassium. That means there's a high risk of hypokalemia. Serum potassium must be monitored before administration. Option 3 is incorrect. Yes, respiratory rate is important for heart failure patients, but before giving furosemide, blood pressure and potassium take priority. Option 4 is incorrect. Urine output is relevant because furosemide is a diuretic, but it's not a before administration priority like BP and potassium. Option 5 is incorrect. Unlike beta blockers or digoxin, furosemide is not dependent on heart rate. Option 6 is incorrect. Liver function is important for some medications, but not a standard pre-administration check for furosemide. This is a classic SATA trap question. A lot of students assume there's only one correct answer, and they either pick just Option 1 or just Option 2, missing the other one. The takeaway? Always read SATA questions carefully and don't fall for the one-answer mindset. And that's just the beginning. We have 9 more NCLEX mistakes to go through, and trust me, you don't want to miss them. So stick with me and let's keep going.
Hey, if you're looking for a solid resource to practice questions and answers as you get ready for the NCLEX, I've got a recommendation that might really help you out. I recently found the Next Gen NCLEX RN Practice Question Bank, Big Book of Question Answer Practice, and it was super helpful for preparation of this video as well. If you're trying to get comfortable with the new next generation NCLEX format, this book is definitely worth checking out. It's got daily practice questions that are designed to reflect what you'll see on the exam, which is awesome because it gets you into the right mindset. Plus, after each question, you get detailed explanations so you'll not only know the right answer but understand why it's right and why the other options are wrong. That really helps you build your critical thinking, which is key for the NCLEX. I also love that it includes study tips and strategies specifically tailored for the NGN format. And if you're like me and need a little motivation, it has success stories and insights from other nurses, which really keep you inspired throughout your prep. If you're looking to practice and build confidence, this could be a great resource to add to your study routine. It's structured so you can stay on track and focus on mastering the material step by step. Just thought I'd share in case you're looking for something to really help with those practice questions.
2. Poor time management. During the exam, you glance at the clock and realize you're running out of time. There are still 20 questions left, and suddenly, panic sets in. You start rushing, second-guessing, and before you know it, you're making careless mistakes. Sound familiar? One of the biggest reasons students fail the NCLEX is not managing their time wisely. The exam is designed to push your limits. You don't know how many questions you'll get, as few as 85 or as many as 150. And because the test is adaptive, every question counts. Common mistakes students make with time management. Spending way too much time overanalyzing one question, trying to be 100% sure. Changing answers last minute because doubt creeps in. Getting stuck on select all that apply SATA questions. Rushing through easy questions just to make up time. How to fix it? The 1-minute rule. To stay on track, follow the 1-minute rule. If you're stuck on a question for more than 1 minute, take your best guess and move on. Here's the truth. The NCLEX doesn't require you to get every question right. You just need to stay above the passing level. Example of a time-wasting trap. Question: which of the following patients should the nurse see first? Option 1, a post-op patient with a BP of 170. Option 2, a pneumonia patient with an SpO2 of 94%. Option 3, a DKA patient with a glucose level of 400 milligrams per deciliter. Option 4, a stroke patient who suddenly becomes confused. Think about it for a moment. Let's break it down. Explanation. Option 4 is correct. A sudden neurological change is a red flag for stroke progression. Confusion, slurred speech, or weakness? That's an emergency. Option 3 is incorrect. Yes, DKA is serious, but a glucose of 400 milligrams per deciliter is expected in a DKA patient. The key word here is suddenly. Stroke symptoms worsening in real time take priority over a stable high glucose. Option 2 is incorrect. A pneumonia patient with an SpO2 of 94%? Not an immediate crisis. Option 1 is incorrect. A BP of 170 is low but still within range, not the biggest concern. This is where many students waste too much time, debating between C and D. Don't overthink it. Pick the clear priority, stroke symptoms, and move on. 3. Memorization. Instead of critical thinking. Here's a hard truth. The NCLEX is not about memorizing facts. It's about applying your nursing knowledge to real-life scenarios. You can memorize lab values all day long, but if you don't know how to use that information in a clinical setting, you'll struggle. Ignoring NCLEX test-taking strategies. Ever feel like you know the content, but still pick the wrong answer? That's because the NCLEX isn't just about what you know. It's about how you think. This exam is designed to test critical thinking, prioritization, and clinical judgment, not just memorization. And guess what? Many students fail simply because they don't use the right strategies to break down tricky questions. So let's go through the top NCLEX test-taking strategies that will help you avoid common traps and choose the right answer. Strategy number 1, the ABCs, airway, breathing, circulation. When a question asks which patient should be assessed first, always think ABC, airway, breathing, circulation. If a patient has an airway obstruction, difficulty breathing, or inadequate circulation, they take priority, even if other options seem serious. Example, a nurse is caring for multiple patients. Which patient should be assessed first? Option 1, a patient with a blood sugar of 400 milligrams per deciliter. Option 2, a patient reporting chest pain and shortness of breath. Option 3, a post-op patient with a hemoglobin of 9 grams per deciliter. Option 4, a patient with a potassium level of 3.0 milliequivalents per liter. Think for a second, which patient is the biggest priority? Option 2 is correct. Chest pain, shortness of breath? Huge red flag. For a possible heart attack or pulmonary embolism, this directly impacts circulation and oxygenation, making it the top priority. Option 1 is incorrect. Yes, a blood sugar of 400 milligrams per deciliter is high, but it's not immediately life-threatening, like a heart attack. Option 3 is incorrect. A hemoglobin of 9 grams per deciliter is low but stable, not an emergency. Option 4 is incorrect. A potassium level of 3.0 milliequivalents per liter is low, but not an immediate crisis compared to airway and circulation concerns. Lesson learned. Always check for ABC priorities first. Strategy 2. Maslow's hierarchy of needs. When choosing between physical needs versus psychological needs, always prioritize physiological needs first. Example, a patient with a history of depression is admitted for a broken leg. What is the nurse's priority? Option 1, encourage the patient to talk about their emotions. Option 2, administer pain medication as prescribed. Option 3, assess coping mechanisms. Option 4, offer a support group for mental health counseling. Think, what comes first? Explanation. Option 2 is correct. Pain control is a physiological need and comes before emotional support. Option 1 is incorrect. Yes, mental health is important, but physical pain needs immediate attention. Option 3 is incorrect. Assessing coping mechanisms is important but not urgent. Option 4 is incorrect. A support group is long-term care, not an immediate need. Lesson learned. Address physical survival needs first, then focus on emotional health. Strategy 3. Safety first. When answering intervention-based questions, always ask yourself, which option ensures the most patient safety?
Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX RN. I know how stressful it can be, especially when you're balancing everything, clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and most importantly, help you feel more ready. Good luck. You've got this.
Example, a nurse is caring for a patient receiving IV potassium. Which action requires immediate intervention? Option 1, infusing the potassium at 10 milliequivalents per hour using a peripheral IV. Option 2, checking potassium levels before administration. Option 3, administering potassium via IV push. Option 4, monitoring urine output before administration. What is the biggest safety concern here? Explanation. Option 3 is correct. Never give potassium via IV push. It can cause fatal cardiac arrhythmias. Option 1 is incorrect. 10 milliequivalents per hour is within safe limits for peripheral IV infusion. Option 2 is incorrect. Checking potassium levels before administration is a good practice, not an emergency concern. Option 4 is incorrect. Monitoring urine output is important, but it doesn't require immediate intervention. Lesson learned. If something is a safety violation, it takes priority. Strategy number 4, the elimination method. When stuck between two similar answers, they are probably both wrong. The NCLEX loves to include distractors that sound correct, but are missing key details. Example, a patient with COPD is receiving oxygen therapy. What should the nurse do? Option 1, increase the oxygen flow to maintain an SpO2 of 99%. Option 2, Encourage pursed lip breathing and monitor oxygen levels. Option 3. Administer a nebulizer treatment and encourage fluid intake. Option 4. Place the patient in a supine position to maximize lung expansion. Be careful. What do COPD patients need? Option 2 is correct. Pursed lip breathing helps COPD patients control CO2 retention and improve gas exchange. Option 1 is incorrect. An oxygen saturation of 99% is too high for COPD patients. It can suppress their drive to breathe. Option 3 is incorrect. A nebulizer and fluids might help but aren't the first-line intervention. Option 4 is incorrect. Never place a COPD patient supine. They need semi-Fowler's position for better lung expansion. Lesson learned. If two answers sound good, check which one is safer and more effective. Strategy number 5. Don't delegate what you can eat. When deciding what tasks to delegate to an LPN or UAP, remember, RNs handle evaluation, assessment, and teaching, EAT. Task can the nurse delegate to an unlicensed assistive personnel, UAP? Option 1. Teaching a patient about insulin administration. Option 2. Assessing a patient's pain level post-surgery. Option 3. Assisting a stable patient with ambulation. Option 4. Monitoring for signs of infection in a post-op patient. Which one can a UAP actually do? Option 3 is correct. UAPs can assist with ambulation, but cannot assess, evaluate, or teach. Final thoughts. These strategies can make or break your NCLEX success. The exam is not about memorization. It's about applying knowledge the right way. Letting anxiety take over. You know the content. You've studied for months. But the moment you sit down at the testing center, your mind goes blank. Your heart races. Your hands get clammy. Every question suddenly looks confusing. Sound familiar? Test anxiety is real, and it can be the biggest NCLEX killer. A little nervousness is normal, but when anxiety takes over, it affects your ability to think critically. Many students second-guess themselves, overanalyze every question, rush through just to get it over with. The result? Wrong answers and a failing score. How to overcome NCLEX test anxiety. Practice with timed exams. Simulate the real NCLEX experience with a timer. This helps train your brain to handle pressure. Use the 4-7-8 breathing method. Inhale for 4 seconds, hold for 7 seconds, exhale for 8 seconds. This calms your nervous system and reduces stress. Reframe your mindset. Instead of thinking, what if I fail? Tell yourself, I have prepared for this. I can pass. Trust your first instinct. Studies show that second guessing often leads to the wrong answer. If you're unsure, go with your gut. Before the exam, listen to calming music, stretch, and take deep breaths. During the exam, if your mind goes blank, close your eyes, breathe, and remind yourself, you know this. After a tough question, don't dwell on it. Move on and refocus on the next one. Remember, the NCLEX isn't just testing your knowledge, it's testing how you think under pressure. Stay calm, trust yourself, keep moving forward, failing to read the entire question carefully. Picture this. You see a question, skim through it quickly, recognize a familiar keyword, and instantly select an answer. Then, after moving on, you realize you misread the question. That one mistake could mean the difference between passing and failing the NCLEX. If you rush, you'll fall right into their trap. Common NCLEX question pitfalls. Absolute words. Be careful with words like always, never, only, or must. In healthcare, very few things are 100% absolute. Negative wording. If the question asks what the nurse should avoid or not do, you need to pay extra attention. Missing one word could lead to the opposite answer. Patient safety traps. Many questions offer multiple reasonable answers, but only one will be the safest intervention. Unfamiliar medications or diseases. If you see something you don't recognize, don't panic. Use process of elimination and critical thinking to make an educated guess. Example of a trick question. Which intervention should the nurse avoid in a patient with increased intracranial pressure, ICP? Option 1, elevating the head of the bed to 30 degrees. Option 2, administering oxygen as needed. Option 3, encouraging coughing and deep breathing. Option 4, keeping the room quiet and dimly lit. Take a second. What is the key word here? You read a question, pick an answer, and move on, but then doubt creeps in. You go back, reread the question, and suddenly think, wait, maybe it's the other option. You change your answer, and later when you check, you realize your first choice was actually correct. Sound familiar? This is one of the most common mistakes NCLEX test takers make. Overanalyzing and second-guessing yourself leads to more wrong answers than right ones. Why overthinking happens and how to fix it. Lack of confidence. If you don't trust your preparation, you're more likely to doubt yourself. Focusing too much on what if, instead of answering based on knowledge, you start imagining hypothetical scenarios. Overcomplicating the question. NCLEX questions are direct and clear. Don't try to read between the lines too much. How to break the overthinking habit. The first instinct rule. Your first choice is usually correct 75% of the time. Trust your gut. Trust the process. If you followed elimination and test-taking strategies, don't second guess. Not practicing enough NCLEX-style questions. Many students spend hours reading textbooks, highlighting notes, and watching videos. But when it comes to answering NCLEX-style questions, they struggle. Why? Because the NCLEX isn't about memorization. It's about applying nursing knowledge to real-world scenarios. If you're not actively engaging with NCLEX practice questions every day, you're setting yourself up for failure. The right way to practice NCLEX questions. Do at least 100 NCLEX-style questions daily. The more exposure you have, the better your brain will recognize question patterns. Use a mix of question formats. The 2025 NCLEX includes SATA, select all that apply, case studies, drag and drop, matrix questions. Don't just practice multiple choice. Review the rationales, even for correct answers. Understanding why an answer is right is just as important as knowing why others are wrong. Simulate exam conditions. Take full-length practice tests with a timer to build endurance. Using the wrong study resources. Not all NCLEX prep materials are created equal. Some books, courses, and question banks are outdated. Others don't align with the new NCLEX format. Many students fail simply because they studied from the wrong sources. Don't rely on just one resource. A solid study plan should include a good question bank, video lessons for complex topics, a content review book like Saunders or Prioritization, Delegation, and Assignment by LaCharity. Avoid memorization-heavy resources. If a study guide only focuses on facts without critical thinking applications, it won't help you pass. Failing to learn from past mistakes. If you've failed the NCLEX before, or even struggled on practice tests, the worst thing you can do is keep studying the same way. Many students take the exam multiple times because they don't adjust their study strategy based on their weak areas. If something didn't work before, it's time to change your approach. How to learn from your NCLEX mistakes. Analyze your weak points. Did you struggle with prioritization, pharmacology, SATA questions? Target those areas instead of reviewing everything. Keep an error log. Every time you get a question wrong, write it down along with the correct rationale. This helps reinforce learning and prevents repeat mistakes. Don't rush to retake the exam. If you fail, take at least 4 to 6 weeks to correct your weak areas before trying again. Change your study method. If self-studying didn't work, try a review course. Failure is not the end, it's feedback. The students who pass after failing aren't the ones who studied harder. They're the ones who studied smarter.